Hello everyone, this is Bob Browner with Community Coronavirus Update number 101. We'll talk about rationing hospital care, some Nebraska successes and failures, what we think we'll do for the holiday gatherings in Omicron. So unfortunately we'll start right with a failure, and that unfortunately we're at the point of rationing care in Nebraska now. So the headlines in Omaha World Herald, Lincoln Journal Star, the hospitals are full, they're pleading with people, please get vaccinated, but we're in a tough situation right now. So, hospitalizations here in Lincoln, Nebraska were up to 125 with 84 from county residents, and so only 41 from outside of Lincoln. Well, why is that number not that high? Well, because we basically just capped it off. I don't think what's going to happen now is Lincoln's not going to be taking people from surrounding areas, or if there is, there's quite a wait because we're running out of time or space just to take care of our own. I think you're also going to see the same in Omaha. So Omaha's numbers really shot off, and people will say, like, I think the biggest mistake I hear people say is, "Well, it got higher last year." Well, it got higher last year, but only briefly. And they had delayed some care so that they could free up some space. The problem is we're still working off the backlog from here. We had a huge lead up to this, and now this is happening, and so the hospitals are really going to go overstretched, and so they are now having discussions about what's called crisis standards of care. So what does crisis standards of care mean? That seems like a pretty generic term, but to make it a little more clear, how might this affect you walking around the community? Because you walk around the community, it seems like everything's pretty much normal unless something bad happens. So mortality goes up at this point, not just from COVID, but from everything else, because things like this will start happening in the next couple of weeks if things can keep getting worse. So your dad may get treated for his heart attack in a tent outside the hospital, not in the hospital. I guess getting treated in a tent is better than nothing, but it's not an ideal way to get treated. Another thing that may happen is if your family's in a car wreck, they may have to treat your family's injuries the best they can where they are, and you may just be stuck there for a while. In the small town hospitals, they'll do the best they can. My early career, I was a small town family doc and covered the urgent emergency room in small towns. And sometimes you get stuck like this, during bad weather, where you just do your best to take care of somebody until the weather cleared. But this is probably going to go on for weeks, and they're already starting to transfer trauma patients, hundreds of miles away because Lincoln and Omaha are full. So you could get stuck. Let's say you're driving in Broken Bow and get in an ice storm and have a crash and you're injured. You may just have to do whatever they can do at Broken Bow and no more, and just take your chances. That's where we could be. We're also delaying procedures, so your mom's cancer surgery could get postponed until the crisis passes. Now, she's not going to die tomorrow of this, but when you have cancer, every day and every week it's spreading potentially, and so your risk of dying from that cancer goes up because we can't get your cancer surgery in. So that's where hospitals are, and so people need to start taking this a little more seriously. And the most frustrating thing is, of course, we didn't have to be here. We could have vaccinated more people, and we wouldn't be here right now. So Nebraska's COVID successes and failures. We do have some successes, so it's not all doom and gloom and negative. So I thought this was kind of an interesting article in Politico where they actually ranked the states on a number of dimensions. I don't know if I agree with all their dimensions, but actually Nebraska came out number one on this. I agree with their economy and education. We have the lowest unemployment rate in the country. Our schools, we all opened our schools a year ago in the pandemic, and I think for most of them actually opened really well. And so those are good success stories. I actually think they underrated us on health, because as some of you know, I like to say that the ultimate quality measure in healthcare is often dead, not dead. And Nebraska actually did pretty well. We were one of the top 10 states as far as a lower mortality rate. Although I will point out that that wasn't a state success, that was a local success. Results vary dramatically across the state based on what people did. And I've had some people ask, well, what about Bellevue, Sarpy County? They didn't do it. Lincoln did, and they had mortality rate close to Lincoln and Lancaster County, which I said, yeah, that's true. However, you have to remember Bellevue is a military base town, and so has a younger, healthier military population, has a lot fewer old people than we do. So they should have done not just, this much better, but a lot better. So they could have actually had rates in the, 60, 70, 80 range if they'd have done, I think, what some of the Lincoln and Lancaster County schools did, for example, with some of our mask ordinances. All still pretty good overall. But if you look outside of Omaha and Lincoln area, though, their mortality rate is up pretty close to the places around us. But we could have beat Colorado. We're about I think total deaths for Colorado is 167. We're 69. We could have beaten Colorado if we'd have just done a little bit better outside of Omaha and Lincoln. But still, overall, pretty good. And the mortality rate, it's not just things like masking. So I think there's a couple of reasons why Nebraska did better. One was the local level masking, which wasn't allowed at the state level, but local Lincoln Lancaster County has been done a pretty good job of this. Some municipalities a year ago did some, and some schools have really stepped up. And I think I really have to give credit to the schools that stepped up that were in tougher areas. So like Omaha and Grand Island, for example, they put in masks despite the political pressures, and they've taken a lot of hits. They didn't have a health department to have their back like we did here in Lincoln. And so I think you really have to give Omaha and Grand Island some credit for sort of pushing against the political winds and doing the right thing. Mass work. So here in Lincoln, for example, I presented as a school board last night. If you look at the Lincoln's rates of spread and the schools' isolations and rates of spread, they mirror almost exactly. And so our rates are really the community rates. However, we've had very little within school spread. Our nurses in our schools are doing a great job with contact tracing, and one of the things they looked at, they had 502 identified potential high-risk elementary school students, of which only 14 of those contacts became positive. That's a 97% success rate. So masks work. They're not perfect. They don't always work, but they are very effective. And I think this argues. And I know that some of those 14, those are kids that might have been hanging out outside of school too. So it could have even been better than that. But really, masks really do work, and they're put in the right situation. And remember, you don't have to be perfect at pandemic. You just have to get spread from one person to be less than the likelihood of spreading one more person. So it doesn't have to be perfect. You just got to be better than one on the reproduction number. Other things are vaccination rates were good in high-risk settings like nursing homes, for example. And so you may have seen this headlines that Nebraska had the top 10 nursing home vaccination rates, and that really did save a lot of lives. So I think we need to give our nursing homes some credit. Middle of the pack on the staff. So we need to get the staff to realize that they have an ethical duty to their elders to get vaccinated, to protect them. That's a constant frustration for people like me, that people don't see the need to protect others. We also had a lot of monoclonal use, much above average. And this quote I heard is that we were given 14,000 doses a week, and we exceeded our per capita allotment. We've actually been applying for and getting more, thanks to in part to Brian Alexander, a pharmacist at UNSC, who's been organizing that effort. So that post-exposure, people got infected, but we've in Nebraska done a much better job than typical for monoclonal use, which is another bright spot. Which goes back to our healthcare system. Our hospital system in critical care is very good in Nebraska. So we do have a really good healthcare system in Nebraska to deal with the failures of public health at the state level, at least. And so, for example, in my day job, I work with one of these accountable care organizations, one of Nebraska's health systems. But you look at everybody, Bryan, Nebraska Medicine, CHI, us independents, everybody has essentially green is above average, light green's better than 50th percentile, dark better than 75th, darker green greater than 90% of ACOs in the country. On all these metrics, we did really well. And so, thankfully, we're in a state where people have good rates. If you want to download the report, I've got a link to it and go to our website. We do this summary of how ACOs did every year. Ted, so if you want to read the report, you can look at it yourself. The failures, though, I think the two things that jump out to me that I wish we could have done better, other than, of course, having a statewide approach to masking when it was needed. One is that we didn't put in a green pass, even at the local Lincoln level. I think this was a major failure in our disjointed vaccination effort. So Green Pass, it's interesting. I keep talking to people who travel all over the country and over the world where they use this, and after a few days, the response to them is, "That was really easy. Why aren't we doing that?" Including my daughter and son-in-law. They just got back from New York on Monday, and they said, you just show your vaccine card and you feel much safer going out. And why aren't we doing that? And so I think the failure to put in the Green Pass is a problem, and it actually does tie into the vaccination rates. So in Italy, for example, you had to either get vaccinated, you had to have a proof of recent infection. They allowed, I think, within the last 6 months, and for them it was a negative test in the last 72 hours. Each country does it a little bit differently, but they give a combination of that. So otherwise, if you're not going to do that, wear a mask, and you have a choice. You don't have to be mandated to get a vaccine. But what would happen over time is some people will get tired of doing these negative testings or wearing a mask, or for example, then they would actually get vaccinated. So there's no accident those countries that put this in had higher vaccination rates. So it's a sort of a passive way to encourage people without mandating them to get vaccinated. And so it's no accident if you look at the vaccination rates by country. Countries that started really well, like United States and Germany and United Kingdom, that didn't put in a green pass system, were passed by countries like Italy and Spain, for example. And the United Kingdom announced that they actually are going to go that way as well. So we need a green pass system so that if you don't, otherwise you got to use the heavy hammer and mandate, and nobody likes those. So it would have been a way to do a better job of encouraging more people to get vaccinated. And then my frustration is that we didn't have a statewide or even a local effort getting all these primary care clinics and ACOs involved. You'll notice that last year, despite a pandemic, if you look at influenza vaccination rates, almost all of us got over 80% of our patients vaccinated because we worked in cooperation with the primary care doctors in these clinics. I wish our state and our local health departments had worked a little bit better with local clinics. Fair question. Like I've said before, what am I going to do? So we're sort of discussing in the Rauner family what we're going to do for Christmas. We're going to have four generations under a roof. We want to get together to have fun and eat and drink and play cards without masks. So our house rules, and this is still not quite finalized yet, but what we're thinking is house rules to come inside. If you're booster eligible, you need to have had a booster. So that's pretty much everybody 18 and above. If you're 5 to 17, you must have two of those doses of Pfizer's. We got a couple youngins there, and if they're under 5 and couldn't get vaccinated, well, we'll probably just do booger tests for them, and we'll probably joke around with them. I think the kids will be receptive to that, so we'll just do the rapid test on those little munchkins to make sure they don't infect grandma, for example. We'll do some rapid testing in Courage. So my daughter and son-in-law, when they got back from New York, they did take rapid tests to make sure they hadn't been exposed while away. And we're doing safe behaviors ahead of time. So we're avoiding restaurants because we don't have Green Pass in Lincoln, for example. We did go to the Jason Mraz concert Friday, which was great, but they required masks. So if I'm going to a place where I can't verify everybody been vaccinated or I'm not confident, we're just going to avoid those places for 2 weeks because we want to decrease the chances that we're going to infect one of our family members. Remember, you got your layers and you got to kind of look at your own risks. Thankfully, none of us have serious health conditions that I know of getting together, so our risk, I'm not as worried. Whereas, for example, if somebody had cancer, it'd be a little different story. So, for example, Bryan Medical Center is now starting to put visualizations, including who has had a booster shot. And you'll notice almost, first of all, most people weren't vaccinated. There are some who are vaccinated, but most of those haven't had their booster. The four who have had booster shots and are in the hospital, one, they're not in the ice, they're not on ventilators, but most of them have something else going on, like they're, for example, being treated for cancer or had a lung transplant, liver transplant, or something like that. And so they have a high risk condition. And the thing is, for those folks, they did the right thing to protect themselves. The reason they're there is because all the other people didn't do the right thing to protect themselves. Kind of like Colin Powell, he had multiple myeloma, he did as much, but somebody infected him. And so the people that killed Colin Powell and the people that put these four people in danger are the people who didn't get their boosters and didn't mask when they were supposed to. So last, we'll finish off with the Omicron update. Again, your local epidemiologist, I would follow her page if I were you. I may not, I'm not, I may, this might be my last update of the year. So keep checking her updates. I think she's doing a really good job of putting a nice summary that's very digestible for most everybody, actually. Still the Crete questions, the same as our, is it more infectious? It's pretty conclusive that that's an issue. So, the rates of spread in South Africa are really just skyrocketing, much higher peaks than any of the prior peaks. So it is very infectious, probably at least as infectious in Delta. And also that infectiousness is the other issue. Does it evade immunity? The answer is yes, it does. And that's one of the reasons why it's spreading so fast, because people who had a prior infection who thought they were immune aren't immune to this. They actually another study panel where what this is basically people who had either the alpha, beta, or delta variants previously. Are they providing antibody protection against Omicron? And you'll see here, here, and here. The answer is pretty much no, actually. So having had a prior infection is not going to keep you from getting Omicron. However, if you got a prior infection, then you had that booster vaccine. Look at here, you've got really good protection. And so just because you had a natural infection, that does help you a little bit against prior variants, but it ain't going to help you. I don't think it's going to help much against Omicron. Maybe it'll decrease your chances of hospitalization a little bit, but you're still going to get sick. And so the boosters, though, are proving to work. So, for example, here's people with two shots against the Delta variant versus Omicron. Is the two shots isn't good enough. However, once you get a booster, so you're right back up in the 70-80% range. And this is their AstraZeneca, which is similar to our Johnson and Johnson, and this is Pfizer, of course, which we are, and of course Moderna numbers have been looking a little bit even better. So getting that booster will protect you against Omicron. So go out and get your booster if you're due. And so is it more severe than Delta? I think we're still answering that question. We'll find out. That's going to take a few more weeks yet to really give a conclusive one on that one. Keep in mind that at the end of this thing, we're not going to make coronavirus go away. Yes, we are going to quote have to live with it, but we don't have to die with it. And so the way to not die with it is to get your vaccine, so you have enough baseline immunity that you're only going to get either an asymptomatic or a mild infection like a cold and not get complications, hospitalized, or dead. Natural infection does not seem to be protecting you enough against this. And the booster plus if you had an infection, you get a booster, it seems to be very effective against this. So what we want to do is turn this into a mild COVID infection that we live with, not any of this, and that's going to require more significant vaccination, unfortunately. So last but not least, of course, I'll keep reminding people that no vaccine is perfect. And we've known this for all vaccines. That's why we try to vaccinate as many people as possible, not just high-risk people. Vaccinating only high-risk people has never been an effective strategy. So just like flu shots, the best way to protect grandma is to get her kids and grandkids of the COVID vaccine, especially before Christmas. So if you're do eligible, you've got a 6-year-old in our house, take them as soon as possible. This, if you get it done this week, you at least have some immunity by the time Christmas rolls around. So hopefully this is helpful to you. Again, the disclaimer, these are my opinions, not necessarily all these folks I work with and for, but this is what I do for a living, so you can verify kind of who I am and what I do.